New at 10, a silent crisis is building in Utah's construction industry, an alarming rate of suicides and other mental health issues.
Yeah, this came to light after a recent construction licensing board meeting, and CDC data backs it up with the construction industry only behind mining when it comes to occupational suicide rates.
Brian Will digs a little deeper tonight and tells us how a local university is leading the way with a new nationwide research study.
March of 2024. I had my personal suicide attempt. Luckily, I'm here today and I survived that. And during that time, as I was getting treatment and going through it, I lost another coworker to suicide. And then I also lost another friend.
Scott Martin realized there was a big problem in an industry his family has worked in for generations.
Nobody wants to deal with it. Nobody knows how to deal with it. And when you're at a job site in construction, a lot of the time you're working by yourself.
I mean, oftentimes it turned more into like 12-hour days.
The pressure pushed Tyler Nurden to get out and work for himself.
Towards the end of my career in construction was like, really like the fact that like now the weekends even are like considered kind of more of a mandatory work day as well, you know? It's kind of really is difficult to separate your work from your personal life.
The stats are staggering, with the suicide rate among those in construction 75% higher than the average and 5 times more than the number of people killed on job sites each year.
The biggest thing I found is people don't know how to talk about it. I don't think it's that they don't want to, it's they don't know.
When you walk through the doors and you're sitting in a room together.
Slade Opikins runs R&O Construction and has started to talk about it with his employees.
I have depression or I have anxiety. I started to hear it so much that, especially with a certain generation, that I just thought, is this how people are now identifying? Is it who they are or is it what they're struggling with? And I, having not struggled with it, I was misjudging, and that was wrong. But for me and for a lot of us at our company, we have learned it is real. And what are we going to do to help? Not just to recognize, but how are we going to ask our employees, how are you doing?
It's not something that's gotten a ton of academic attention.
James Smith, a professor at BYU, is leading a research team that is studying mental health in the construction industry. The overall goal, reduce these deaths of despair.
Is the industry itself behind a little bit compared to other industries, would you say?
Well, I would say yes.
Smith and his researchers are gathering the data and testing their theories. But this study will take years to come up with concrete solutions. In the meantime, employers are on the front lines.
And then we quickly learned that getting the right help has a waiting list of like 3 months. And that's too long.
Now, with the help of the Associated General Contractors of Utah, companies are coming together to try and help. The first steps they've taken is acknowledging the problem and talking about it. Their next focus is changing the culture of the industry.
What we as managers in the construction industry can do better is set realistic deadlines, not commit to deadlines on projects that make everybody give up their home life.
You have somebody struggling, or if you're struggling yourself.
While Martin continues to share his story in hopes of helping others.
I feel like I've taken that pain and we've turned it into a real good purpose.
A purpose with a lot more work to be done. Brian Will, KUTV 2 News.
Okay, that study, just shy of 2 years old, is working to secure external grants to fund it for another 20 years. The Associated General Contractors of Utah started hosting a mental health summit and has established a hub to help fight the growing problem. So if you're struggling with mental health, we put a list of resources on our website. Just go to KUTV.com.